Dr. Jessica Friedman from MedEdits Medical Admissions. I wanted to do a video about COVID and medical school admissions. All of us around the world are facing unprecedented times with this virus, and it is impacting everybody. And as many of our students, in fact, all of our students really, are at home at this point with a lot of unexpected time on their hands, I wanted to reach out to our entire audience, our students, as well as the entire pre-medical community, to talk about how COVID is impacting or may impact medical school admissions in the future. As everybody knows, this is an evolving situation, and some of what I'm going to discuss today is going to be speculative, because none of us really know what the future holds, both the immediate future and the more distant future. And so I'm going to sort of present some various possibilities of what may happen and what you can do to position yourself so that you can someday be at the forefront of helping with pandemics should anything like this ever happen again in our lifetimes. Obviously, first and foremost, we want all of you to be safe, to practice social distancing, and to really listen to what is being said by the media. Certainly there are many people who are not necessarily following those instructions, and I just want to impress upon you that it is very, very important to practice social distancing, to stay home as much as you can. In speaking with many of my friends around the country, they are really preparing for an onslaught of patients and are already experiencing shortages of PPE, personal protective equipment, and work is becoming much more stressful for them. So the more that we can do to contain this virus, the more that we are helping each other, and the more that we're helping the medical profession as well, and enabling all of them to do their jobs as well as they possibly can. So let's kind of get into this. And, again, it is now March 18th. So, as I said, this is an evolving situation. So what I'm going to discuss today, really is about sort of this point in time where we are right now. And MedEdits is going to do everything that we can to keep all of you updated with regards to what's going on with, the MCAT, with what should you be doing to distinguish yourself, since probably your research and other experiences at this point have been canceled, and may even be canceled for for even longer than perhaps you anticipate, maybe into the summer. So, it's really important that all of us stay positive and to remain hopeful and to realize that there are still things that you can do. And now you have a lot more time to do things, and you also don't have to rush in the same way. Certainly in my home, we are finding that it's actually the slowdown in some way is sort of nice. There's not as much rushing around. My kids are now doing distance learning. We're cooking more. We're watching more movies, which is something we never do. So, try to use this time to sort of appreciate some of the things that you might not necessarily do on a regular basis. Read a good book, really engage in those hobbies that you can do at home. So anyway, so let's kind of launch into this. Okay, so first and foremost, I'm going to talk about academics. With the shift to online learning and distance learning for virtually all college students, even medical students at this point, special master students, the large question becomes, well, medical schools, don't take online classes. They don't accept online classes as far as counting towards prerequisites. And obviously this is, and I'm going to repeat this, throughout this video, but this is an unprecedented time, and the medical schools are going to do things as well that are unprecedented, right? So medical schools, of course, everyone's going to be in the same boat at this point. So medical schools will certainly accept online credit. We still encourage you, if you're going to take any courses online or not, to take those at the most prestigious institution you can. But certainly if you are enrolled in a four-year undergraduate college, or any sort of academic program, postgraduate program, and those that institution converts to online learning, of course, the medical schools are going to be accepting those grades and accepting those courses, right? So there are going to be some changes that are going to be made here that have never been made in the past, okay? Some colleges are also allowing students to, take classes pass-fail, as opposed to taking those classes for a grade. I still discourage taking a course, especially if it's a prerequisite or if it's a math or a science. I discourage a student from taking any course pass-fail. You still should do your best to take that course and earn the absolute highest grade you can. Now, on the sort of subject of academics, now that you have more time on your hands, this is also a time when you can potentially take additional coursework. Are there other subjects that interest you? And are there other online courses that you can take? Certainly online learning is booming these days, and any subject that you are interested in, that you want to learn more about, there are courses, both for credit and not for credit, that exist out there, whether that's through Coursera or whether that's through, MIT online learning. There are plenty of courses available to explore your academic interests further. Okay, so think about that as a way to sort of, fulfill your curiosity and to sort of demonstrate your interest in different subjects. Okay. Now, the other concern that students have are activities. Research is canceled. Students are being pulled from research. This is both at the undergraduate level and at the medical school level. And I'm going to be talking about how all of this is impacting residency admissions in a separate video, because that's a completely different set of things to be concerned about. So, with activities being canceled, it's going to be very difficult at this point for students to get clinical exposure. That includes shadowing, that includes, even potentially working as an EMT. Students are being pulled from things because everyone wants you to be safe, and we also want to decrease the numbers of people who are out there and who are in the workforce who don't need to be there, to decrease the spread of this virus. So what can you do to do something that shows your interest, and also to kind of keep you busy and to set you apart in the application process? And, the most obvious thing become things like, making a podcast about your favorite topic, creating a blog, creating a website. Those are very sort of, obvious ways that you can, sort of distinguish yourself and to kind of showcase what interests you. You can also figure out how can you contribute in your own community. Certainly there are tons of kids that are home right now that are, their parents are probably going crazy. If they, parents with little kids, it's very hard to entertain little kids, for 16 hours a day. So things like doing online tutoring for elementary school students in your community. Maybe if you're part of a certain religious group, perhaps doing some sort of religious education, because, things, religious education as well is no longer available. Are there elderly people in your community that you can help? So think about ways that you can make an impact within your own local community. And that certainly is a way, again, to really make a valuable contribution. Another thing to think about is, are your professors doing any type of online research? Or are there any things, can you be involved in research in any way that doesn't involve necessarily going to a lab or being involved with patients, and, that involves patient contact? So reach out to your professors and see if there's anything that you can participate in that doesn't necessarily involve leaving home. You might also want to call your local Department of Health. Certainly there, with drive-by testing being set up in many, many cities, there will be different ways that the Department of Health might have that you can, that you can assist either directly or maybe through outreach or something of that nature. So, all of these ways, think about in terms of making that impact, think about how you can do that locally within your home community now that you're home, since the vast majority of our students are at home at this point. In terms of letters of reference, letters of recommendation, if you are applying this spring, if you're planning on applying this spring, and the MCAS timetable and TMD, SAS, and ACOMAS, they have not changed their timetables. So all of those systems are going to be opening in early May, and you can submit TMD, SAS, and ACOMAS in early May, and MCAS you can submit at the end of May. So you want to be requesting letters of reference now, okay? everybody is overwhelmed by this, okay? Everybody is. So your professors, even though they, in theory, they might have less to do, you know, they have to take care of themselves as well. So you want to give your letter writers as much notice as possible so that they get those letters submitted as early as possible. They may want to do, you know, Skype sessions with you know, to talk to you and, you know, things of that nature since they can no longer meet you in person. So make sure you request your letters of reference as soon as possible. Now, with regards to the MCAT, this is a huge consideration for many of our students because certainly there are many students who are planning on applying to med school in May of 2020, and you know, and we're planning on taking the MCAT in March, April, May, June. Okay, right now the Pearson VUE centers, and that's those are the centers that administer the MCAT. Pearson VUE centers have closed through mid-April. I anticipate those closures could go on for longer, okay, just based on sort of the trajectories, based on, you know, what's happened in Italy and in China. I think that those closures could go on for longer, okay? Of course, we do not know this yet, all right? A few things to think about, all right? Medical schools, I do wonder if the medical schools, with regards to admissions this year, if they will be changing their timetable in order to accommodate those students who are taking later MCATs, right? Because they are aware of this. They know that many students who are applying to medical school in May or June of any given year are also taking their MCAT in May or June. So I think it's possible that the medical schools are going to, you know, are going to push their timetable forward a little bit so that maybe they don't start reviewing applications as early. Again, this is all speculation. We don't know what's going to happen, but the med schools know what you're going through, and they also are overwhelmed by all of this, right? So all of the people in the medical schools, especially if they are practicing physicians who are on admissions committees, they're all super duper busy now because all physicians who are working in medicine, whether that's emergency medicine or, you know, really dermatology, I mean, anything, they're being called upon to help out. So I anticipate that even if MCAT dates are canceled for a certain length of time, I think the medical schools are going to be much more accommodating in terms of not having that negatively impact your application. Now, we certainly are seeing that our students who are trying to take later MCATs than they anticipated, they're not having trouble signing up for those dates. They're readily available. I do think as well that if more MCAT dates are canceled, I think that the AMC will add more MCAT dates, right? Because they understand that that population of students who was going to take the test earlier now is going to take it a little bit later, and they're going to want to accommodate you, okay? So I do think that something else we're going to see potentially is the AMC adding additional MCAT dates. So again, that remains to be seen. You know, this will all become clearer in the coming weeks and even in the coming months, okay? Now, another question that we are sort of fielding with our students is, you know, if you're on the fence about taking a gap year, it's possible this actually could be the year to take a gap year, simply because there is so much that's unknown. There is, you know, depending on sort of where the weaknesses are in your overall candidacy, are you going to have time to sort of fill in those gaps and to address those weaknesses? And it's possible that if you won't be able to do that because of various closures and various activities and experiences and opportunities that aren't happening this summer, this actually could be a really great year to take a gap year. So something else that we're kind of revisiting with our students who are on the fence, should I apply, should I not apply? This could be a great year to just say, you know what? It's time for a gap year. I'm not going to apply this year. I'm going to apply in the spring of 2021 once everything normalizes. Now, something else that I've been kind of thinking about and we've been kind of thinking about is, will this be a less competitive year for medical school admissions because so many students are going to be kind of scared off by the fact that they can't take the MCAT when they wanted to because they can't get the research that they were planning on doing all summer. So we are wondering if the numbers will dip a little bit in this upcoming application cycle. Again, this is pure speculation. I don't know if that's the case, but I could see that this entire situation could deter some people from applying to medical school this year, and they might then decide to apply next year. Okay. And obviously, if that is the case, then next year's cycle becomes more competitive, right? So these are all things to weigh. When working with students, now that we understand what's going on with COVID, we certainly are going to be looking very carefully at students' activity profiles, their academic profiles, which is something we always do, but we're going to be looking at it through a different lens at this point, because I think that there could be some tipping of different balances here. The other real takeaway here is that because all of this is completely unknown and no one knows what to expect, and everyone's primary focus and primary ideal is to just keep everybody safe, medical schools are going to do things they haven't done before, right? They're going to make exceptions they haven't had in the past. Same thing with the AAMC. I can see, depending on what happens with different travel restrictions in the fall, that medical school interviews maybe would be virtual via Skype as opposed to in person. We are already seeing that our students who are having remaining medical school interviews this spring, those interviews are being converted to Skype interviews or Zoom interviews. And so that's already happening. So the big question becomes, when we shift to the fall during interview season, will those interviews in the fall also be virtual as opposed to in person? And I certainly could see that happening with a high likelihood. The other question is, and I've mentioned this earlier in this presentation, is does the whole timetable sort of get shifted, right? So typically medical schools will start reviewing applications in July. We'll start extending interviews as early as late July, early August. So the question is, does all of that get pushed back? Okay. And just sort of be patient. The key thing here is to be patient, to let this kind of all unfold as it's going to unfold. And, obviously to stay safe, to stay home, and, to be as creative as you can be to, kind of figure out what you can do to still set yourself apart, to explore your interests, and also to kind of maintain your sanity. We certainly here have been taking a lot more walks. We've been going outside much more. We've been exercising more. So think about, how can you make this really unbelievable period of time that we never have experienced before in our lifetimes? How can you make this the best for you? And so we are here to kind of try to help you come up with ideas. We are going to be having different types of virtual meetings and presentations, and I would love to hear from you. Well, what would you need? What would you like to see from us? How can we help you? So please email us, info@mededits.com. I'd love to hear from you. If there's anything you want us to talk about, if you want us to have, Facebook Live meetings, we're here full time. We're always here full time. That is really no different. I am no longer practicing clinical medicine. So I'm here to help you 24/7. So, I hope to, pop on Facebook Live and, whatever else we can do to kind of keep in touch with our students, keep in touch with the medical community, the pre-medical community, to keep you guys motivated, to keep you positive, and to uplift you. So thank you so much for watching, and, subscribe to our channel, go to like our Facebook page, all that good stuff, so that we can keep in touch with you, and so that, we can kind of keep you on track. Okay. All right. And wash your hands and social distancing. Okay. Take care. Bye.